Okay. Can you see my slides now?
Not yet.
Not yet. Okay, sorry. So, going here. Bear with me. Can the one of the help me out, please? That's sir.
You can proceed with your presentation.
Right. So, is there any one technician to help me upon that, please?
Κάτω δεξιά, άμα κάνετε
Is
κλικ στην παρουσίαση, κάτω δεξιά.
okay. Yes.
Εκεί.
Okay.
Okay, now we can see your presentation.
Okay,
You can
thank you.
proceed
Thanks a
now.
lot. Okay, thank you, and sorry for that delay and the trouble that I made. So I have no potential conflict of interest. So it's a very easy, straightforward case, but it caused me a severe mental trouble. So it was November last year that I got a call from one schoolmate who asked me about that his father has severe aortic stenosis. He was a very good friend, one of the best friends of my dad. So my dad passed away 2015, being at the time 93 years old, and his friend was still alive, being 98 years old. At the time, it was very troublesome for me because this man was a family man. I knew him very well, and my concern is whether this patient was fit or not, and he was 98 years old. So I asked my friend whether this patient, his dad is fit, and he told me he's absolutely fit. So I asked him to bring him across to assess him. So I have been in trouble, and how will I action upon to this case? But I consider that it just as to consider this patient just a nonagenarian patient, a person who is over 90. Keep calm. You are Michael. You are an interventional cardiologist, and you have to manage the case. And many cases in the United States, 1 out of 7 cases doing TAVI is a nonagenarian. So I started thinking positive, so that patient could be a healthy survivor, having surpasses nowadays life expectancy by more than a decade. That patient could be a patient having the ability to overcome the competing risk and might be of a good shape patient and most resilient to sustain this condition, this intervention. So hoping that this patient was a good 90 or good nonagenarian. So I try to believe that this patient was a good nonagenarian. So a good nonagenarian are increasingly referred for consideration for TAVI. So clinicians are tasked to identify these good nonagenarians or the healthy survivors. So who will likely tolerate the procedure and derive meaningful benefits. A forecast that's imperfect, but we have some information upon that. So selecting the good nonagenarian for TAVI involves forecasting what is the short-term risks. We have tools for that, mid-term recovery and long-term benefits of the procedure. So selecting the good nonagenarian is we have to estimate his cardiovascular and other comorbidities. I mean, whether he has coronary artery disease, myocardial infarction, atrial fibrillation, CKD, stroke, etc. They all are incorporated in the well-known STS and Euroscore. And in addition to that, another score, the ACC-ATS score, TAVI, which actually accepts cases up till 100-year-old. So apart of that, there is a variable that is not very easy to be estimated. That's the frailty. That means the ability of the patient to recover mentally and physically after having the procedure. Many scores have been evaluated, and the Frederick Tabb study compared several of them, and it was found that EFT, the essential Frail toolset, is very effective in assessing this patient. So I sat down, and I estimated all these scores to that patient, and in particular, the essential Frederick toolset that encompasses 4 parameters: that the ability of the patient to have 5 chair rises in the time that is needed this to be done, and whether the patient has cognitive impairment or not, whether the patient have a normal or no hemoglobin, and whether it has a normal serum albumin. So it has been shown that this Frailty Index is working very well, and patients having a 0 have excellent mortality rate. Have a 0 mortality rate in the first year, and very low mortality since the patient have until 2. The score after 3 and 4 have extremely high mortality rate. So, going to my patient, I have the permission to show his picture. He's a 98-year-old man in November 2024, having an STS score 12 and Euro score 7.1 and ACC STS score 3.6. All these scores were high as due to his old age, nothing else. His Frailty Index was just 0. So the estimated risk of this patient was 100% survival in the first year. So we decided to proceed to this 98-year-old gentleman. This is the 3-dimension analysis showing the severe calcification of the valve, good dimensions of the valve and of the annular and the LVOT, and very good peripheral arteries. So we proceeded to that case. It was very good right femoral artery TF access, and we finally managed to do that case with a predilatation, just one predilatation and 20-millimeter balloon, and we super annular evolute valve, which actually working very well, and finally we have an excellent outcome with no paravalvular or central valvular lane. The patient is well doing now. It is 6 months after the procedure. He is very well. He's doing very well. He's back to normal activities. He is nearly 99. He's very well. He is doing all his activities with no restrictions, though he was hospitalized due to acute pulmonary edema before the intervention. So this is the man. Look not at the man, but look at the doctor. How happy was that? After a couple of days of his discharge, going to his home to assess him and drinking coffee with him. He's an old man who used to buy candies from me when I was a child in Kalymnos. So take-home messages. As the population ages, clinicians will encounter a growing number of non-Nigerians suffering from severe aortic stenosis. AIDS alone is inadequate to stratify patients. Appropriate patient selection should consider individualized estimated procedural risks and functional recovery, and for improved quantity and quality of life. Frailty is much more revealing, and the EFT score is very useful in selecting appropriately these patients. Thank you for your attention. I think it was a straightforward case, but mentally very troublesome case for me. Thank you.
Thank you, Dr. Zaidis. Because of the time limit, thank you for the very interesting case. There are no comments, and we're going to proceed to the next case from Alexandroupoli University Hospital.